In Mafobera, a village in Jinja City, a district in Uganda, is where a story of transformation and community empowerment has unfolded over the past 2 years. Each month, Busoga Health Forum has been conducting a remarkable ear, nose and throat pro bono outreach at Mafobera Health Center 2. This initiative has not only bridged a vital healthcare gap, but has also woven a blend of hope and well-being across the region. Busoga Health Forum, a non-government organization in Jinja City, stands as a unifying force, bringing together professionals, opinion leaders, and stakeholders within the region, with a vision of a health-thriving Busoga, and their mission is to rally Busoga professionals to use evidence to engage community, government, and partner action for better health of children, youth, women, and men in Busoga region. Rooted in the principle of local ownership and shared resources, Busoga Health Forum mobilizes people to contribute and aligns regional participants for collaborative implementation. This approach is strategic, founded on data-driven insights and the power of partnerships. Working in close harmony with the Ministry of Health, regional local governments, health facilities, and civil society organizations, Busoga Health Forum facilitates coordinated health interventions through well-established technical working groups and administrative structures. A compelling force behind this transformative initiative is Dr. Fred Biso, an ear, nose and throat specialist attached to Mulago National Referral Hospital and a dedicated board member of the Busoga Health Forum.
My name is Dr. Fred Biso Waguma. I'm a senior consultant, ear, nose and throat surgeon based in Mulago National Referral Hospital. Here where we are is Mafobera Health Center 2 in Mafobera Parish, Jinja District. The reason I come here is number one, it is in the area where our association, Busoga Health Forum, chose to launch its operations. We chose to launch here, but we hope that with the increased capacity, we can serve the rest of Uganda. And incidentally, by the way, we're already serving the rest of Uganda. So Mafobera Health Center 2 is one of the luckiest centers because we decided to be offering services here, at least on a monthly basis for a start. The reasons for choosing it, number one, is because it is in Busoga, but also number two, being a peri-urban area, it is easier for us to reach, but also it is easier for people from various parts of the region to reach. It would have been harder if, say, we chose Nawankandro Health Center. Not very many people can easily get to Nawankandro, so we decided to choose a center where we can come, and when we make an announcement and we say we are bringing services to Mafobera Health Center 2, Bugende Health Center 2, Budondo, these are easy to reach by anybody coming from any part of Busoga or any part of Uganda for that matter. And indeed we get many people coming from outside Busoga. Yes, so yes, that's the reason for its choice. Okay. Why we do this? It's also partly because Busoga is one of those regions in Uganda with the poorest health indices. Busoga is one of those parts of Uganda with poor coverage of specialist health care, meaning there is a limited number of specialists. and I mean real specialists, ENT specialists, which is my discipline, ophthalmologists, orthopedic specialists, mental health specialists, specialists in reproductive health. We have, but the numbers in Busoga are poorer in proportion to the population that is served. The numbers are quite small. In particular, ENT, the whole Busoga region doesn't have an ENT specialist working in a government institution. We have only one ENT surgeon who is in private practice. And she only comes, she's a part-time and even private practice, because the hospital the institution where she officially works is a university located 150 kilometers away from there. So she's even here as a part-time in private practice. So you would say Busoga doesn't have an ENT surgeon as of now. And this has been the case for the last 3 or 4 years. So I come here because I chose to belong to an organization, Busoga Health Forum, which organization was launched partly because health professionals coming together realized that there is a need to increase access to specialist health care here.
The profound impacts of this initiative echoed through the stories of patients who once faced daunting odds. These patients, once burdened by the lack of proximity to proper care, now find solace and healing right at their doorstep.
One day at home, seated on my small radio, it was in the evening, I heard the program. They were talking about ENT.
On which radio station?
It was Busoga FM.
Okay.
So when I heard they were teaching about the hearing problem, the throat problem, and the nose problem, how parents were failing to handle such children about it. So when I heard, and I have a child who is having that challenge, that is my boy, for over 4 years. Well, I've been getting treatment for the boy, but it has not been all that good. So when I heard about it, I brought my boy here. The first time I came, they gave me just actually the doctor wasn't here. There was another doctor, so that doctor told me I'm referring you to the next month. That doctor will be there, is a surgeon. So I came. When I came, I met him. The next visit, they treated the boy. Actually, they advised me how to handle him, because I've been beating him thinking he's just stubborn. But through the teaching and all the advice, the counseling they gave me, they told me how to handle the boy, and really I'm very happy because I didn't know about it. Busoga FM was like the advertising what they do. So when I reached here, the information I got is the counseling that they try to counsel my boy. I actually to counsel me as a parent on how to handle the boy, how to talk to him, and even to teach him, to tell him what he's supposed to do like him.
And what impact have these services in the clinic created in your boy's life and in your life as a parent?
Like I've said, it has really helped me because I've been ignorant about
My name is Dauke Fred. I'm in charge of security at the facility. I have worked here for 3 years. This ear, nose and throat pro bono clinic started shortly after I started working here. This program has worked very well, mostly to those who listen to Busoga One Radio. Teaching is made about treatment of ear, nose and throat. And people are coming here for treatment from all over Busoga district, like Uganda, Kaliro and Namayingo. and people have always responded to come for treatment. Every time the doctor is here, we have at least 60 patients and above. I want to thank the doctor. At times he comes with other doctors to help him treat people who always leave this place happy. Some who come for the review are always encouraged by the doctor to adhere to treatment, as hearing is gradual, not an instant cause. After taking treatment, he always encourages them to continue with treatment. So, this program has helped us so much. People who would travel to Mulago National Referral Hospital to see a doctor, some could even wait for a month. The little money they have gets used up, spending it on meals, accommodation and traveling. When doctors started an organization, Busoga Health Forum, where they all convene, it has helped and extended the support. We believe when the forum gets more resources, our people will benefit more. Thank you. Busoga Health Forum's impact extends beyond the outreach. Surgical cases identified at Mafubira Health Center 2 receive support from centers of excellence like Chabira Surgical Center in Jinja District and Hope and Healing Center in Iganga District, all found in Uganda. These centers provide surgical services at a highly subsidized cost, making essential health care not just accessible but affordable. At the helm of this transformative journey is the CEO of Busoga Health Forum, tirelessly steering the vision of empowerment and change.
Yeah, my name is Moses Chanwa. I'm the Chief Executive Officer of Busoga Health Forum. Yeah, Busoga Health Forum is an association of like-minded professionals and people of Busoga and beyond who have interest in stimulating health and development. And our biggest role here is to mobilize people to take care of their own health. So we do this through a number of engagements, through the different government structures, through the different community structures, through the different partners who have interest in health. So that's what we do, but our main issue is to see that the people are able to take care of their own health through the different engagements that we do. Yeah, ENT is one of the biggest problems we have in the region is that we don't have enough professionals who understand and provide care for people who have problems of ENT. So in Busoga, we are lucky that in our founding board members we have an ENT consultant, Dr. Busoga. And so when we were discussing the problems of the region, he came out to say we can mobilize so many other professionals like him to give back to the society. So Dr. Busoga gave himself as a person who can mobilize other people in his profession to contribute to reduction of the burden of ENT problems in Busoga.
The culmination of Busoga Health Forum's efforts is a celebration of transformed lives, unity and shared hope. Through this initiative, we have witnessed firsthand how the Busoga Health Forum's commitment has reverberated, touching hearts and lives across the region. The Busoga Health Forum's ear, nose, and throat pro bono outreach has not only provided essential health care, but has also ignited a sense of community ownership, hope, and a brighter future for all.